So a lot of recent advancements have been made in that specific field that have changed the way that we select haploidentical donors now. Specifically, there was this one CIBMTR study that looked at more than 1,400 patients and the donor-recipient pairs who underwent haploidentical transplant with post-transplant cyclophosphamide-based prophylaxis. And then they looked at whether those donor and the recipients were matched at this B leader site or not. So this is a novel concept that was not known before. And what that is basically, the concept of B leader states that there are certain leader sequences that are present outside of the peptide binding region and which were not previously considered into the donor selection choices. So the hypothesis was that if you are matched at that B leader site, you would have better outcomes as compared to the donor recipient pairs if they were mismatched at the B leader site. And that is indeed what they saw in their publication, that patient and the donor recipients who were B leader matched, they had significantly improved overall survival as compared to the recipient and the donor pairs who were B leader mismatched. Other HLA loci also contributed to outcomes. For example, HLA-DRB1 non-permissive mismatches, they were associated with improved overall survival. HLA-DR mismatches were associated with lower risk of relapse, and HLA-C mismatches were associated with higher risk of chronic GVHD. So now we have a lot of these exciting data showing that the HLA factors contribute more towards the outcomes rather than the traditional way of looking at just the non-HLA factors. So I look at all of those factors for making donor selection choices.